Good afternoon, this is TTT Live and the TTT Live online on Facebook. I'm Dike Rostant with a COVID-19 review. Now, we are very happy to announce that TTAP, this is the Trinidad and Tobago Association of Psychologists, they have graciously agreed to spend some time with us each Monday and Thursday in a mental health moment as we discuss a response to COVID-19 from different mental health viewpoints. Now, we're kicking it off with a bang with the current TTAP President, Clinical Psychologist Wendy Jeremie. Good afternoon. Thank you for being here, Ms. Jeremie. And I want to start off by asking you for an overview of TTAP's general role in the landscape of the nation's mental health.
Good afternoon, DK. Well, thank you very much for having me represent the Association of Psychologists. About 6 weeks ago, we launched a hotline to mitigate the mental and psychological effects of COVID and to help impacted individuals and their families regain control of their anxieties.
There's a low food for her.
Over this period, we received about 400 calls. And we realized that what we have been doing, when we looked at the whole thing, is crisis counseling, because this is counseling behind closed doors. People are ringing. We don't know them, they don't know us, and they want to be helped. So we have to be very immediate in what we do, you see? And that's the overview. We found, though, our data show that things like anxiety, depression, family issues, relationship issues, people were concerned about how they fed their families, depression, of course, and fear, and all of that came up in our data. So, COVID really raised an alarm, a threat in our society, because we don't know how long it will last, where it is going, and how transmissible it is. And we must face the human consequences of COVID economically, socially, and psychologically. You see, it has caused major disruptions, and we know that. There are many challenges associated with families living together for an extended period of time. There are changes to children and young people's lives. No avenue to go on, right? Routines have been interrupted. Schools have been closed. No access to education. And then we must practice social distancing, which is absolutely necessary, but may not be so natural for us to do because we are social creatures by nature. And with all this restriction and reduction of those activities and pleasant events to which we were accustomed, this confinement brings anxiety, depression, anger, frustration, isolation, loneliness, stress, and fear, all of which can be triggers that make mental illnesses markedly worse now. They can be triggers. With being indoors so long, people get restless, they're hopeless, they get irritable, they get bored. Remember, they can no longer leave their houses at 10 o'clock to go and play the mark by the lotto booth. It is as simple as that. They need to go to buy their newspapers, buy the shop, and come back. These are activities that have been cut off. What about the man who dresses himself to go down to the promenade to have a beer with a friend, to play some chess and cards there? All of that has been cut off now.
I mean, all of these things that you're speaking about, Ms. Jeremie, I'm very grateful that you and the folks at TTAP have agreed so readily to help to address these issues. And because this is not something that can be covered in 15 minutes by any stretch of the imagination, but in terms of being able to consistently provide bite-sized chunks that we can digest and help to work into the psyche. But with regard to the workload and many of the things that you mentioned just now, I'm wondering what does the workload of TTAP look like at this point in time, as opposed to a little earlier?
Well, we have this hotline, we have divided it into areas, okay? In the West, the East, Central, and South. And we have about 4 psychologists in each area who can be called for assistance. That's what we have we've been doing at this time to help us cope. You know, we even have to decide how long we'll go on for, because we ourselves can get, you know, a little overwhelmed. But we realize that it is needed because mental health issues are very real in our country, and people do need help at this particular time because of the issues we had seen from the data. People just need somebody to talk to, and they call. They need it for any number of things. They can't get through with the services, right? So they call us. We have to listen. We have to direct them where they can go for assistance. So we have to know, we have to have these numbers handy for them so that we can tell them. We are also assisted by the Victim and Witness Support Unit, who we call on for assistance with clients who might be suicidal. We have to examine that very carefully before we do so. You see, so there are a lot of issues that present, and we can also refer to each other for assistance if, you know, we need to. So this is the sort of work that we've been doing at this time. It can be overwhelming, but we are here for the course of COVID, which is going to be with us for a very long time.
But looking at humanizing mental health in Trinidad and Tobago, one of the things I want to comment on is the fact that that list, and I'm sorry that I didn't prepare it properly to have that list available now, but please, you'll remind me of psychologytt.what. But one of the things, when you look at that list and you have different numbers to call, one of the things that I noticed is that as opposed to just saying, okay, well, you could call this number if you're in this area, you call this number if you're in this area, you actually have a first name of the person that you're calling. And
That's right.
I think that human touch, it just means so much more in terms of someone getting that information. Was that a conscious effort to do that because of that?
Yes. Yes, we just said we'll put our first names because including all the names, when I say the surnames would have been too much for the flyer. So we decided just to put the first name and number of contact. And people can call. Sometimes we get a call which is not in our area, you know. So people have everywhere to call. West, East, Central, and South. So they can call any number that they want. We even have somebody from abroad in the United States who they can call, and a Spanish psychologist on board, so that, you know, we make it very available to people who need to use the service.
You keep on speaking to the data that you have that helps to determine the waters that you're charting and going forward. Now, you've spoken to different geographical areas in Trinidad and Tobago, Spanish speakers, whether or not you are outside of the country, but there are also two more categories or numbers that you have people to call. One, where you have just a young child, or another where you have a child with special needs. Why? What was the importance of actually having those numbers there for those specific needs?
Well, remember, everybody's home now. So children can't go out to school, or they may not be able to access where they go for their special education. Parents now have to help with that child. So they can call those two people who are having particular problems with their children. They can consult with those psychologists on board for those reasons, for their special needs. That's why we have included them on the list.
And I appreciate you doing that. I want to shift gears a little bit and talk about traversing the digital space. We spoke with a lecturer from the IGDS, the Institute of Gender and Development Studies, a little while ago. And one of the things that she spoke about was the fact that we may need to operate a little differently because so much is happening online, but we're also working online as individuals as well as employees. So I'll just want to play that clip for you to get your comments on it. Thank you. So I think we'll do that now.
Right.
Online profile looks like, but two, organizations need to recognize that the online space is now where we are expressing ourselves. You can't keep not hiring people, kind of stalking your workers online and then taking umbrage to everything that they say online and wanting to hold it against them in a workspace. Because if we're living online, everything is going to come out online. And so that high level of censorship, that's going to have to shift, because if it's harder for me to get to my friends just to share, and I have to do everything in a digital space, that venting is going to happen in a digital space as well. So we need to become more careful about what we say, but organizations need to stop having this stranglehold on workers. And we all need to try to find ways to get the work that we need to get done outside of a face-to-face context, which can be hard because some things, in truth, they are just better face-to-face. they are better face to face. But there's accommodations that will have to be made because this is the world we have now.
So you spoke to the person putting on clothes to walk down the road and buy a paper or have a drink with their partner, with their friend, a brethren, or a contemporary. But that's not possible at this point in time. So we're developing new rituals of being and sharing and routines.
Yes.
What is your comment, or how do you respond to this clip from Ms. Moore?
Now, when I saw that clip, I thought it was very similar to what we were doing in psychology. Okay? We are doing crisis counseling, which is behind closed doors. It is something that assists individuals to cope and support and give them support in a major crisis. It is something that is brief, time limited, and with specific goals, you know. It increases an internal sense of empowerment and safety. And we can also refer clients to other resources. Now, it could range from 15 minutes to 2 hours and take place between 1 to 3 sessions. Now, however, it is not a substitute for long-term therapy, but it can provide a safe outlet for immediate relief. When I looked at that, the clip this morning, I think that lecturer was talking about ethics in the main, because remember, psychologists too, let me shift it a bit. We do research, we have to practice, we teach. So as professionals across the field, we have to make an adjustment to a sudden shift in working conditions. And that's what you're speaking about. With COVID and social distancing, that has changed how psychologists administer therapy to their clients. So with transition from the face-to-face communication to remote communication, ethical challenges emerge. Confidentiality and boundaries must be maintained. Look, researchers have to collect data. How are they going to do it? Are they going to still pay people to collect their data for them? What about lecturers who must deliver quality education to students? How is their timetabling going to fit into all of that? Now, as I read the literature, there's a Dr. Rebecca Schwartz-Met, and she's the assistant professor of clinical psychology at the University of Maine, and also the chair of the APA Ethics Committee. APA is the American Psychological Association Ethics Committee. She said this: it's a crucial time for ethics to be salient and central, because they really are the cornerstone of critical thinking and flexible decision-making. I repeat, it's a crucial time for ethics to be salient and central, because they really are the cornerstone of critical thinking and flexible decision-making. So the landscape has changed. Of research, teaching, practice training has changed, and it will be so for a long time. This is the landscape in the office. People not going there anymore, but distance education, digital. So here are some considerations put forward that we can practice. We have to be competent. We must know how to use the software. We must know how to troubleshoot the hardware and the software. And we must know about network-related problems that clients may face. We can't go pell-mell into it without knowing what we're using. What sort of, the tele-based platform that we're using, tele-based health platform that we're using. Informed consent, we have to discuss the benefits of providing this kind of service through video conferencing with the client, because here's the risk, as she spoke about in the interview. Here's the risk. There may be a session that may well be hacked into, as we are told these days about Zoom, and what we are seeing may be overheard. You see, we also must tell the client, by staying home, both the client and the therapist are less likely to contract the virus. Now, what about confidentiality? With everyone being around at home, confidentiality may be a little difficult to maintain, because confidentiality is key in the therapeutic alliance.
And what may also be hard to maintain is this conversation, just because we're running out of time. But before we go, though, Ms. Jeremie, please remind us of the website, the TTAP website, where we can get the information, get the numbers to call in terms of continuing this conversation.
Right. You go to psychologytt.org, press the red button, and it gives you everything all our contacts. We are here for you. If you still feel this way, you call us at psychologytt.org. Press the red button and it gets you to us right away in the West, East, Central, and South.
Thank you so much, Wendy Jeremie, current president of the Trinidad and Tobago Association of Psychologists, TTAP. They are here for you, her words. And this has been the COVID-19 review to this time. Thank you so much for tuning in. My name is Dike Rostant. We will have more as it obtains, but news is next at 4 o'clock.